Showing out back there. Mr. Howard, thank you. So we also have State Representative Park Cannon. Again, current and former elected officials do not have a time limit. Representative Cannon.
Good afternoon. Thank you, council members. I'm here today because our state of Georgia, we are in a state of almost emergency with sexual and reproductive health, and we need your help. I want to tell you a little bit about why I believe that an allied approach is necessary and give you a little briefing on ultimately what is going on. So the state in 2017 updated Department of Public Health protocols, making it so that any provider must give information about life-saving medication known as PrEP and PEP. That's pre-exposure prophylaxis and post-exposure prophylaxis. They're pills you can take daily in order to remain virally suppressed and not be able to transmit HIV, as well as making sure that you are healthy. In 2018, the state did allocate an extra $50,000 to the Ponce Clinic, which many of you might know is right across from the Krispy Kreme on Ponce, and makes it so that anyone who is living with HIV can access services. But unfortunately, the state of Georgia was unable to pass a piece of legislation that would fund even further something that we need to the tune of $400,000. It is estimated that it costs about $400,000 for a person living with HIV to remain healthy. But the Department of Public Health does have a strategy that goes through 2022. Now, what is Fulton County doing? As you know, Fulton County has the duty of health. They do actually have a PrEP clinic. They do help people navigate through care, and they are trying to increase their funding. They do include funding for HIV in their own budget. What is the City of Atlanta doing so far? Well, the City of Atlanta is a fast-track city. Many of you were still on council in our previous administration when we committed to a 90-90-90 strategy. That is a global strategy to keep people virally suppressed, linked to care, and ultimately able to lead healthy lives. But unfortunately, that does not account for the racial disparities that go on in the City of Atlanta. 4.7 times more black men are newly diagnosed with HIV than those of Caucasian descent. And 14.1% black females are diagnosed with HIV more than those of Caucasian descent. Right now, we have at least 32,000 people living with HIV in the City of Atlanta. That's 32,000 people living with HIV in the City of Atlanta. And there's only 57,000 in the state. So if 32,000 out of 57,000 are within the City of Atlanta and within Fulton County, it definitely is something that we need an allied government approach to. So I want to thank the city again for opening an equity office. This is the first office that I think is really tasked and available to, with their department on LGBTQ affairs, address this. As the only openly LGBTQ elected official for the entire City of Atlanta and for the entirety of Fulton County, I submit to you that I will do whatever is necessary to help you understand these disparities. I would love to come in to brief you as a full council, but for today, I ask that you do look into this budget that you will be passing to see if it is possible to fund our HIV disparity. Thank you very much.
Thank you. Thank you. Okay, we have Devin Barrington Ward, A. Minifield, followed by Ken Allen and Tracy Thornhill in that order. And if you could be ready to come up as soon as the next speaker, you're the next speaker, it'd be appreciated. Thank you.
Thank you, Madam President. My name is Devin Barrington Ward. I serve as the Senior Policy and Advocacy Advisor for the National Black Leadership Commission on AIDS. As Representative Cannon alluded to in her remarks, the City of Atlanta has become ground zero for the HIV epidemic. Here are a few statistics that are some of the most disturbing. According to Emory University, 60% of black, queer, or gay men have a 60% chance of becoming HIV positive before their 30th birthday in the City of Atlanta. 800 black men have died from AIDS complications over the last 4 years in the state of Georgia. Black women are 14 times more likely to be diagnosed with HIV than their white counterparts. These issues are fueled by these numbers are fueled by many issues, some of them including housing, sexual health education disparities, homelessness, and a litany of other social and structural determinants of health. Myself, Representative Cannon, and Eric Polk from Georgia Equality met with the mayor last week, and it was an extension on a conversation she made during the campaign. Some campaign promises around supporting the HIV effort here in the city of Atlanta by making sure that the city puts a line item in the budget to support those efforts. The number that has been thrown around, many of you all are familiar, is about $250,000 to support PrEP services in the city of Atlanta. We know that PrEP is effective at keeping people from becoming HIV positive. This is an opportunity for the city to partner with Fulton County and the state and to be a leader on this issue, because federally we see that there is a lack of leadership. Our hope is that you will continue to be a partner, that the partnership will grow, and that we can work together to end this epidemic, and that the city of Atlanta can be the change agent for the entire Southeast. We hope to work with you all on how